I woke up one sunny Friday morning, less than 2 weeks ago, with the realization that my right implant had ruptured.
Georgia, don't be scared.
Roll the camera.
Why?
Because it's where
Through your consent forms, you're gonna read through.
it's what they're selling. It's what they're selling.
I've been reading it, and she'll actually read
I've
it.
been through your pharmacy information, so you'll just print your name up here, and then pharmacy name, address, zip code here. Want us to do it?
Yeah, I'll do all that.
Ooh, Fenugreek and Zofran.
And paying attention.
Can I get you a water, Coke, Diet Coke, Coke Zero,
I'll take a water.
cold or room temp?
Room temp for me.
Yeah.
I just brushed my teeth, and I feel like I like the mint and the cold water just doesn't.
Yeah, it's gonna take you
I
out.
want to be able to like onboard the hydration, because thought process is that
What
I'm
is
gonna
it
really
set
be
for?
onboarding the
June
caffeine.
4th or
So I can't drive home. What I'm hearing, I can't drive.
you
myself
can't
home.
drive for 2 weeks. Idiot.
Well, Meg, do you want to explain what's happening today? Or what's been
Sure.
happening? What's been occurring?
Well, I woke up one sunny Friday morning, less than 2 weeks ago, with the realization that my right implant had ruptured. So we do find that it is a good time to finish off the other body work that my children have and my weight loss has set ahead of me. I will be getting a lift, re-implant, which is covered because they shouldn't rupture. I'm going to be getting an abdominoplasty, ab repair, because I've got a significant ab separation from
Babies.
housing 9-pound babies. Luca was 7 pounds but 5 weeks early, and he was 20 inches long, so he would have been well over 10 pounds and 24 inches long. Bev was 9 pounds and 22 inches long 2 weeks early. And then they'll do some lipo and internal corseting for the figure of a lady.
That's crazy.
It goes bonkers, okay?
Are you like nervous about surgery? Like, does that make you nervous?
I'm not a nervous person, I don't think. I feel like maybe I am, and it just
Not about the
manifests
big
in a different-
things.
Huh?
Not about the big things.
Mm-mm.
Yeah,
No, I don't think.
I don't think
Cool
so
the
either.
cucumber. I get it from CSH and Wendy.
Yeah.
But they're not as cool as cucumbers. They're more like dill pickles sometimes.
Am I right?
I just want to know how well this ages for me. How does this mature? Okay.
CH is like
He's cool as a
nonchalant.
cucumber.
He's
He's
very-
until
until
he's
he's
chalant. And
There,
then
the
he
line does
goes, And he
exist.
goes from being an ice cold cucumber to just a real spicy
Yeah.
pickle. Do I look like one of the kids? With my
Have you worn
golf
those
gloves?
before?
No, you don't, Megan. Well, maybe you do. Your socks are dirty.
That's because of how you wash them.
Nah. These two,
Okay.
you need to like initial and sign.
Saline filled breast implant. Yep.
That'll do it.
I am going with saline because I just feel
It's
better about
actually
it.
the unpopular opinion. It's
It
more
is.
popular to do silicone.
I think
Yeah.
I think people are just looking for like that natural squish, and I really could care less. I never had any
It
trouble until
appears
the
more
rupture.
natural.
The rupture.
The rupture before the
The
rupture.
Hey. Just here to circle Jesus back into anything we do, okay? Lots of
It's all-
sensation in the breast or nipples. I've never had any sensation there, so.
Oh, that's
When I rescheduled your mammogram,
Mammy.
Mammy.
different agent answered the phone, and she was some like super sweet old lady, and she had to run me through all the like questions again of like things you have to know before you go through with it or like get a mammogram. And she was like, okay, is there any chance she's pregnant? And I said
Absolutely
no.
none.
And
She's a
she
virgin
was like oh well, whoever you talked to before marked it down as yes, so I'm just gonna have that changed. And I was like
Is this foretelling? No.
I just want to let everybody know that not only have I been abstinent for 3.5 years, I do believe I'm a born again virgin. At 41, I'm back to original factory equipment. Okay.
I hate hospitals. I get horrible anxiety in
Yeah,
hospitals.
it's awful. I mean, it could be this contraption right here.
Yeah, what is
It's-
this contraption right here?
It's an exam bed.
But why can't they make it like a color that isn't like
But why is
regurgitated?
For the record, like, did you want like a nice bright cheery color? Because
Yeah,
we don't
I did.
like.
I like cherry. But
I'd
this
like
is
anything
giving,
but-
institution.
Yeah, it's giving like padded walls,
Psych ward.
like straight jacket.
They're like, we're not gonna waste our time on aesthetics. Like, we are just gonna sculpt your body to the gods.
That is the aesthetic.
I heard it, an anesthesiologist say they can, like, especially with cigarettes, like when they put the thing down, the tube down, they can like smell it in your lungs. I'm gonna go to the bathroom, guys. Sorry. Oh, I forgot my methane blue.
So you're not nervous, you're not anxious, you're none of the things.
You want to know what I'm nervous and anxious about? I'm nervous about walking up the stairs for the first time. I'm nervous about how soon I'm able to shower since I really like to shower.
Since you shower 80 times a day.
Yes. I'm nervous about how quickly I can get back to the salon. I'm not looking at this like it's a vacation. Yeah, like I have extreme anxiety about not being. I might just have Kelsey drive me by the salon just so that I can
Ease the separation anxiety.
it really scares me.
Yeah.
Being away from the salon. And it also scares me that Bev's gonna just mollywop me. Because she has no understanding of her footprint on my life physically. She's just like,
All the feelings are for post-op,
yeah.
not for a huge surgery.
Also, I've decided, unpopular opinion to myself, can you please show your nails? I think that that's what I'm gonna be going with, just right pre-op and post-op.
Look at my nail beds. Little babies. They're little chicle.
All right, y'all ready?
We're ready.
Okay.
So ready.
All right, so we have surgery scheduled, right?
We
A
do.
couple weeks. So tell me what we're gonna do for you.
Okay, my right implant ruptured and they're about 15 years old.
Yeah.
I've had kids, I've lost about 135 pounds. It's time for a lift and re-implant. I also am interested in having a abdominoplasty. In the consultation that we had a week ago, we discovered that I do have an ab separation. So that is going to be part of all of that.
It's hard to believe that I've known you that long. And we did your
Yeah.
first surgery before babies and all. So
Yeah.
it's fun to see you back. Okay, so let's kind of go over everything again.
Okay.
We're going to plan on doing a breast lift this time. We'll change the implants out. And you have saline implants. So the nice thing about a saline implant is if it leaks, you're going to know because it's just salt water and it's going to go flat on one side.
What would happen? What would it look like if something happened with silicone?
So that's a good question. So here are some silicone implants that we have. So for example, this is a silicone implant and you'll hear these called gummy bear implants.
Mhm.
And the reason we call them gummy bear is the gel is what we call cohesive, and that means it's sticky. So
Mhm.
if this were to leak, if you think about a gummy bear and we cut it in half, it doesn't necessarily change shape or size. So you
Mhm.
can have what we call a silent rupture and you wouldn't even know that
Mhm.
it's there. Okay, so for a silicone implant, we do recommend that we get either an MRI or a high resolution ultrasound to
Yeah.
check for that. Because as you said, you've had baby and breastfed and all that stuff.
Mhm.
You've had some sagging over the years, so
Mhm.
we'll do a lift this time. That's going to involve is making the incision around the areola, and then one straight up and down, and then one that goes under the crease. And so we mentioned that we call that a keyhole incision or an anchor incision. Now, size-wise, are we thinking same size, bigger, smaller?
I don't want them any bigger,
Okay.
but I have realized in the last week as it has continued to fall that I don't want them any smaller.
So similar to that.
Yes.
Okay.
With
right.
the lift, are you sure you don't want to just go a little bit smaller?
Can you talk me through what all of that.
So the shape in itself is going to look so different. So if you imagine this is the side that's not leaking. So
Yeah.
if we do a lift and keep you similar in size, it's going to give you something like that.
Like-
It does limit how much I can lift you with a larger implant. So I probably wouldn't go too much larger. So the only
I don't
thing
want
is-
to go larger.
But what'll happen is I have to take into account that I'm going to be removing some tissue with the lift.
Mhm.
Okay, and also you had quite a bit of asymmetry before.
Yes.
So I'm going to try to actually even that out with the lift this time. Before we use different sized implants, almost 100 cc difference. Okay, so now that we're going to do the lift, what I'm going to try to do is remove a little bit more tissue from the bigger side and
Yeah.
keep the implants more similar. Let's say with a breast lift, we remove 100 grams or so. I want to keep that in mind, so I'd actually have to put a little bit larger implant in to keep the same size. So I don't want to go too much larger. Okay, make sense?
Mm-hmm.
Okay, and then your belly, like you mentioned, the separation, we call that diastasis. And what happens over time, and mostly with pregnancy, is the rectus muscles or the six-pack muscles stretch out. Prior to pregnancy, the muscles should be connected together in the middle. And if you expand with the pregnancy, they stretch out, and most of the time they don't come back together. When we do the tummy tuck, I'm going to stitch those muscle edges back together. Okay, we're not going to cut the muscle. We're just going to stitch the edges back together, and that'll make it look like you're sucking in, but you won't have to suck in. Other thing
Love
that
that.
I'm going to do is I'm going to do these little corset stitches on the side for the side muscles or oblique muscles, and that's really going to draw in that hourglass and give you a really pretty hourglass. And you already have a beautiful hourglass placed here to begin with. Okay, your incision is going to go from hip bone to hip bone. This little tattoo here is going to be removed completely. Plan on everything from your belly button down to your bikini line will be removed.
Okay,
and then
good.
all this is going to be pulled down nice and tight. So all these stretch marks from belly button down will be gone. We're going to do some liposuction back here in that plank or muffin top area,
Yeah.
and then that'll give you that nice soft contour. So we're going to use two little drainage tubes, and they're going to come out right here in the pubic area. They'll be stitched to your skin, and then these will just kind of be hanging out like this. We're going to pin them to your little binder. I told you we'll have a little binder for you and a little sports bra, and then you're going to be emptying these once a day. They're going to be in for about a week or so.
Will my lift require drains?
No. If we were to take them out and not put something back in, I do put a little drainage tube in, because then you're going to have this big empty space there, and I use a drain to prevent that from filling up with fluid. Generally, with putting an implant back in, it's going to take up that space in that pocket.
What is the difference between the surgeons that put them on the outer hip versus the inner pubic area?
And we can do either. I personally think it's easier here. Sometimes I think when they're placed on the sides, they don't make a separate incision, and it can get infected from those open area. Also, I do think it's easier for you, because your incision's going to go out pretty far here, and to have them hanging from back here, it's going to be a little bit more uncomfortable.
Yeah.
Also, harder for you to drain them.
You find that it's more comfortable here?
I find that, yes.
What I understand is that the drains are highly uncomfortable.
They're not really painful. They're more of a nuisance, I'd say, because they're in the way. They kind of can tug sometimes. They're pulling. When you take a shower, you have to be careful. Best way to do that is I'm going to have you get like a little lanyard or a shoelace. We actually have one here to give you. So put the lanyard around your neck, and we're going to clip the drains to that when you're showering, so that they're not pulling. Any other questions on what we're going to do for now? Okay, perfect. So I'm going to go over some little instructions. Well, Sabrina's going to go over the instructions with you, and then I'm going to go over medications.
High pain tolerance, low tolerance for narcotics.
Okay.
Both C-sections that I had, I was off of them within a day of being home.
So I think you can compare this to a C-section. You'll have more spasming than anything. I found that the incision isn't the painful part, it's more the muscle tightening. But any allergies to medications?
None that
Okay,
I really know of.
Okay, I will be sending in prescriptions in advance so that you can pick them all up and have them before surgery. Okay, you don't start any of these till after surgery. I do need to send something in for pain, even if you're on it for just a couple days. And I think as soon as we are able to wean off, I'm happy to get you off and maybe switch over to like extra strength Tylenol or maybe some ibuprofen. I'm also going to send in something for nausea.
Send it. I respond really well to Zofran, but also Phenergan as well. So like whatever you feel like, I don't want to be nauseous.
And then I'm also going to send in a little patch to put behind your ear before we start anesthesia. If you've ever been on a cruise or on an airplane where you see some people have a little patch behind the ear, that helps with motion sickness. We've also found that it helps with nausea after anesthesia. And on the morning of surgery, you're going to take your shower and make sure everything's nice and clean, and you'll apply the patch behind your ear and then wash your hands after you apply it, and then you just head over to the surgery center. Okay, so what we found is if it's been on for several hours before you even wake up, then your risk of nausea is really low. So we have something called Exparel, and what it is it's a longer lasting local anesthetic, and it's enclosed in a lipid bilayer. So what it does is I inject it at the time of surgery. It can give you up to 72 hours of pain relief. So it's just kind of slowly released over 72 hours. You're concerned about being on narcotics and you'd like to take as little as possible. And it's those first couple of days that are the most uncomfortable. So I think that will be really good to have that on board for you.
Is there any side effects from it?
Nothing major, no.
Okay.
Okay, you excited? Okay, any other questions? All right, so that's it. Thank you.
So nice to meet you.
You're a main part of this. How far do you guys live from here?
You excited?
About
No.
All right, Meg. You're all done.
Hey, got the whole family with you.
Oh yeah, we roll deep. Great. Just my pre-op appointment. We just talked about all of the things.
Still for June 4th, but they'll move me up if they've got time. Alrighty. Okay. See ya.